Hi, everyone. I'm Dr. Lombardi. Welcome to Improving Cultural Competency for Behavioral Health Professionals. This is a really fun topic, and it's one that I personally really enjoy. So I'm looking forward to getting deep into it, learning more about you all, and learning about the unique challenges you have in your practice with this subject. So nice to meet all of you, and let's head on to the next one. And this, Fide, could you go to the next one, please?
Sure. Okay, so these are just a few housekeeping items. Just a reminder that all participants are muted upon entry. Please make sure that you engage in the chat. And if you would like to also participate verbally, you can just click on the raise hand icon that is at the bottom of your Zoom dashboard. Also, this meeting is being recorded, and the slides and the recording link will be sent via email after today's session. And this is just some information about the National Center for Health and Public Housing. The NCHPH is supported by HRSA, which is a program by the U.S. Department of Health and Human Services, and is a national training and technical assistance partner. This information or content and conclusions are those of the author and should not be construed as the official position or policy of, nor should any endorsements be inferred by HRSA, HHS, or the U.S. government. And the mission of the National Center for Health and Public Housing is to strengthen the capacity of federally funded public housing primary care health centers and other health center grantees by providing training and a range of technical assistance activities, research and evaluation, outreach, and collaboration.
Starts to hurt your confidence after people make disclaimers before you talk all the time, Fide. You know that?
That's correct. Okay, so this is just some information about health centers that are close to public housing. As of 2021, there were 1,373 FQHCs that served to over 30 million patients. There were also 458 FQHCs that are in or immediately accessible to public housing, serving 5.7 million patients, and 108 PHPCs serving over 900,000 patients. So in terms of public housing demographics, there are 1.5 million residents with 2 persons per household. 38% of them are disabled, 91% are low income, 32% are female-headed households with children. And in terms of race, 52% are white, 43% are African American, 26% are Latino, 19% are elderly. And this kind of brings into perspective the need for, cultural competent services that health centers can provide. Okay. So now I'm going to pass it on to Kevin.
Okay, let me get to my notes. Okay, so again, welcome everyone. I love behavioral health workers. I love behavioral health, and I particularly love this topic. So this is like the man, moment, machine time for me of an interesting topic that I really want to share with you. This is a sensitive topic. It's a topic that requires a lot of conversation, a lot of cross-fertilization of ideas to really understand on a personal level. And you can't really be culturally competent or really understand culture as an SDOH unless you understand it on a personal level. So it's a reflective subject. I would love for everyone to pull their camera on if they can. I want to see your smiles, want to see your faces. And if you could, please, I can also send you some articles on how it's been very well validated that having cameras on leads to more enjoyment during webinars. So anyway, let's discuss the general format of this LC. It's going to be different than what some of you typically may involve yourself in. Culture is a topic that requires self-reflection to understand. In order to properly understand how culture does and could impact you and your patient, you need to have reflective access to your own worldview. Diversity isn't just a slogan. Having access to insight into the cultural backgrounds of colleagues, and we are all colleagues here, helps to understand this topic better. It provides an important vessel for self-reflection and better understanding of our patients. Culture, cultural competency, and cultural as an SDOH are all extremely complex subjects. Unlike in the biomedical or pharmaceutical fields, where mechanisms of reactions or drug actions are often well understood at a molecular level, we know that this drug works on this receptor or something of that sort. Cultural anthropology and human sociology are immensely complex, to the point that we as humans don't really super understand how a lot of things work so well. As a result, it's difficult to study this topic, and the data available is less detailed than in other sciences, and it's complicated to talk about. So it requires cross-fertilization and understanding. And cultural competency, first and foremost, is important for our patients. It allows us to treat them better. It allows us to understand them better. And perhaps most importantly, it makes them more comfortable in our presence. And that encourages follow-up, and that encourages follow-through and enjoyment in our patients. But cultural competency is also important for yourself, your personal life, your career, and your career advancement. A better understanding of this topic provides key insights into the communities we serve, and how our facilities can better manage those communities, and how they can be better managed by those communities. So there's my disclaimer. Moving on. Next one, please. We're on session 1. We have a total of 4 modules in this learning collaborative. Let's discuss the format again, specifically today. This will be an immersive introduction into the field and the various subjects that influence it. In order to take something from the experience, you really need to participate. So there will be questions that I'll ask you to fill out, to answer, 1 or 2 sentences. Have a notebook or something electronic that you can put things down on. It does require actually putting them down to really understand what we're doing. And then we will be sharing. Sharing is not required. Some of these topics are very personal. They may be very private to us. And we may just not be very good at sharing or want to share. I understand that. It's highly encouraged. Verbally expressing these ideas or the answers to the questions we'll be going through, you may find that it helps you to understand it better and makes you enjoy it more and makes you more effective. But that's just my recommendation. After we go through questions, I'll be randomly picking people. If you don't want to, if you're one of those people who doesn't want to answer, just say pass, I'll move on. The safety word is pass. So in order to address the clinical aspects of culture, we need to understand it on a personal level. So we will be personally reflecting on these concepts as well. Mental fatigue is real, and it's hard to go into this stuff sometimes after a long day or a long week. But I encourage you to try to put as much mental energy into thinking about it on a personal and deep level as you can, because it makes it easier to understand. And also, this is a fun topic, so it should be fun. I've sat through many lectures on the mechanism of action of drugs or new therapies for certain diseases, and it can be difficult sometimes to stay connected, even if it is a subject that interests you. Culture is something that really everyone can find something interesting in, because it's just so broad and it's so interesting, and it really is an intrinsic part of the human experience. So it's fun. So let's be light and respectful of our colleagues. We'll be sharing things, and this is a sensitive subject. So let's try our best to be open to new ideas and to each other. And what I like to say before I talk about a difficult subject with people is that we're all ultimately limited by our perspectives, and are trying our best in our field to widen those perspectives. So expanding our perspectives of difficult subjects can be difficult and time consuming. So let's support each other as much as we can through that. I will be sharing clinical vignettes from my practice throughout this webinar. If you have something that you think is particularly interesting or maybe important to the group, raise your hand. We'd love to hear it, as long as patient information is being protected and appropriately communicated. So also, this is a new lecture. So I don't really have a great concept of how long it will take. So we might not get through everything. I will be cutting things off exactly at 2 o'clock out of respect for everyone's time. Questions? Fide, can you see if people are raising their hand?
Yes, I can see, but I don't see any questions at the moment.
Okay, let me know if anything pops up.
Yeah.
Cool. So if anyone has questions, put your hands up like whenever, and Fide will tell me. Next one, the learning objectives, please.
Okay.
Okay. So we'll be presenting and dissecting cultural and cultural competency conceptually in the concept of behavioral health. We will review current research and developments in the field and engage collectively with culture and cultural competency through self-reflection of our own cultural identity and values. Finally, we will move into reviewing the practical applications of culture as an SDOH. Next one, please. Okay, and next one. So here are introductions. This is a small enough group that I want to get to know all of you guys throughout this. And I want to encourage you, if this is something you're interested in and something piques your interest, send me an email. And do they have access to that now, Fide, or do I need to give that?
Yeah, they have access to the email in the welcome packet that was shared with them earlier, and also at the end of the slides.
Cool. All right. Okay, so let's do introductions. As I said, my name's Dr. Lombardi. My background is as a physician and epidemiologist. My bachelor's degree is in anthropology, though, and before I wanted to be a doctor, I wanted to be an anthropologist, and I love this material. What I found later as a physician, that a background in anthropology and understanding how important culture was a unique advantage that I had in my clinical practice and in my classwork. So this is something that I came back to after becoming a practicing physician and seeing just how important it was, and how important it was to teach this subject to people who may have not had the background that I had. It's also a very personal subject for me. I'm first generation American. My parents are from the south of Italy, and I grew up in a largely Italian American community. Most of my community, about half of them spoke English, about half didn't. And part of my life growing up was in helping my family and my community navigate the systems that are part of this country. Anyone who's a first generation immigrant or second generation may have had a similar experience. But something that I noticed as I got older was how incredibly difficult it was to talk about behavioral health in my culture. And as I got to know colleagues from other cultural backgrounds, I started to see that this wasn't a unique thing to my cultural background, and that many people struggle with this. And that piqued my interest. So anyway, that's me. And let's go to you, Fide.
All right. Well, thank you, everyone. Thank you, Kevin, so much for that really nice introduction you gave us about the topic and about yourself. So a little bit information about myself. My name is Fide Pineda Sandoval, as shown there, really long name. And I am the health research analyst here at NCHPH, and I provide analytical, technical, and logistical support to the team. And prior to joining NCHPH, I worked in providing clinical and administrative assistance to healthcare providers for many, many years, and more specifically in dental offices that provided services to low-income patients from many cultural backgrounds. In many instances, I also served as the translator so that patients could understand their treatment plans, their payment options, and any other resources that were available to them. And in my most recent work, that involves developing training materials for community health centers and resources that they can utilize for their patients that are culturally competent. And I received my BS, my Bachelor of Science in Global and Community Health from George Mason University. I am also a certified health education specialist, and I am currently pursuing my MPH. And I believe this topic is meaningful to me because being in a good state of mind basically helps us make better decisions in every aspect of our lives. And this could be at a personal level, at a professional level, and this will also help us make healthier choices to prolong our lives. Once we know how to reach that capacity, to reach a desirable level of mental well-being, then we can also help others make better choices. All right, so now we want to hear from all of you. And we want to know, what is your professional and educational background? Why is behavioral health meaningful to you? And how do you define your cultural background? So we're going to open up the mic so that you can provide your feedback. And you can also, if you're not able to participate verbally, you can also provide your responses in the chat.
So I'm going to go through the roles on this, Fide, okay? And I'm going to start with who's first on my screen. I'm going to be taking notes too, as you guys just quickly answer these questions so I can better know you. Hey, let's start with Jill Cowie. Hi, Jill. I can't hear you.
All right, I'm unmuted now. All right.
You're here. Let's
Okay,
hear it.
I'm here.
Let's hear it, Jill.
Grateful to be here. Thank you for the introduction. So my professional and educational background is got a master's in social work in the 80s. I became a nonprofit director, focused on employment, and then a lot of volunteer work at the community level on housing, affordable housing, midlife crisis, got a master's in divinity, spent the next 15 years as a Unitarian Universalist minister. And during COVID, the world of church became too small. And I really wanted to bring my pastoral clinical skills to communities in need, and strongly believe in a cultural foundation to this work, and that people basically have what they need, you know, internally, if the conditions are created to create health, and it's an honor to be part of that process. My cultural background is I'm a second generation American. My grandparents came from the Highlands of Scotland, pretty much impoverished over here for a long, long time, but they adopted about over like 50 foster children, I think partly out of need, but also out of love. And so that's a pretty cool legacy of my grandmother. And public health, I mean, I think I touched on why public health is important to me. I mean, it's just looking at the person holistically, and there's huge systemic stuff that it's inexcusable. And so it's just, you know, the oppression and the systemic stuff that goes on. It's good to be on the side that is trying to turn that around. So that's me.
You're not hiding your frustration about that.
Yeah.
Very nice to meet you. I think you have a fascinating background, and I'm interested to hear how the divinity background and your social work background creeps into your perspective on this subject. Thank you so much.
Yeah.
Ms. Lambert, Becky.
Good afternoon. I am a behavioral health program manager for the Maine Primary Care Association. So I work with all of the federally qualified health centers throughout all of Maine to help them implement or even start to implement trauma-informed care principles and practices, and provide training to them, any kind of technical assistance I can, as well as the Zero Suicide program throughout Maine. And my background originally was in education. I did speech therapy and decided that it was too restricted and I couldn't do what I should be doing. And I was doing what someone was telling me was appropriate instead of what was good for kids. And I decided I couldn't do that well. So I moved on and I started, I was a master yoga instructor, started 2 yoga studios, and did that for years and loved it, but decided at my age I was done working nights and weekends and moved on to get my public health degree. And from there, kind of fell into the trauma-informed care, behavioral health world. And I think I was going through school at the start of, I just finished my public health degree. I was finishing up during the pandemic era, just beginning, which was a very frustrating political / public health crisis. So I feel like this has become my passion because I feel like it's just so needed and missing and everywhere in our culture. So throughout everything, whether it's our our professional, our private, our personal. I just feel like we need so much more of this everywhere. So
I think that's a very good way to articulate that. I was an ICU doc during the pandemic, and I saw my patients and my own mental health and my colleagues' mental health all kind of disappear in the 6-month period. So I certainly appreciate that there are people in the field that care as much about this as you do. And what a unique background too. I'm looking forward to seeing your contributions to this. Thank you so much. And we have Miss Woods next. Hi, Miss Woods.
Hi. So I'm Kiana Woods. I got my degree, my bachelor's degree in anthropology, and I minored in East Asian studies. I am currently a housing choice voucher program manager here at the Jeffersonville Housing Authority. And then behavioral health is meaningful to me. It has a lot to do with my background and where I've been and the sort of the things what I've been through and what I've experienced from like other jobs, even before getting into housing. I worked at places like in the food industry and then warehouses and stuff. And mental health is overlooked a lot, especially like in housing with our lower income people. And that's why it's so important to me. How do I define my cultural background? Well, I am African American is one of the main things I think about when I think about my cultural background and what that means to me and where I've come from and the sort of things, my history and all that for my people and just in general for American history and what it means. So that's like, I guess, the biggest way I would describe my cultural background. I'm African American.
I appreciate how grounded you are in that. So thanks for sharing that perspective and looking forward to hearing what you have to say going forward. Thank you. Next, we have Mr. Joshua Nye. Mr. Nye, welcome.
Hi. Apologies for being late today. I was pulled into another meeting right before I was supposed to jump onto this training, so I just want to apologize for that. But I am the Director of Behavioral Health for Charles River Community Health. Before that, I was an outreach worker for the Merrimack Valley, predominantly Lawrence and Haverhill, for about 10 years, and then went on to run a residential program for about a year within Lawrence. And then I joined Spectrum, who was a vendor of the state, particularly for Essex County Sheriff's Department. And I was the clinical county administrator for Spectrum and the Essex County contract. So I helped develop 4 of the 8 programs that were withstanding in the contract for all those criminally involved. Did that for about 2 years, and I actually just started this job. This is my second week, so there's that.
Congrats.
So great, Joshua. Keep it up.
Right. So I'm very happy to be back here. So in Lawrence, I was very familiar with Greater Lawrence Family Healthcare. Very similar. All healthcare or community healthcare is important to me, and coming back to it, it feels really good. I make the joke with everybody. It feels good to have my cell phone again, because you're not allowed to carry many things when you're in the jail. Feels good to wear a belt again. So there's that. So outside of that, in terms of my education, I have a master's degree in counseling psychology and family systems. I have my license. I'm an LMHC. In terms of my cultural background, I am, or at least identify as, Lebanese. So again, there's a huge Lebanese population out of the Lawrence area, at least when I was growing up. And so I spent a lot of time in Lawrence and being around my family in large numbers. So I identify a lot with that community, and I identify a lot with the Lebanese culture. I'm also Swedish, so there's that other piece. And in terms of behavioral health and what it means to me, behavioral health is important to me on a lot of different levels because it allows me to understand everyone that comes our way. Everybody has a different approach to life, and everything affects people differently. And making sure that we understand where each person is coming from and how we adapt to others, I believe is important, considering that we're always shifting and adapting with the times. So here you go. Thanks for letting me join.
Thanks, Joshua. I'm familiar with Lawrence. There's certainly a unique mix of different people from every country you could think of, and it's surprisingly in a small place too. So it's a really interesting place. Also, plug for everyone for Lebanese food, especially the pastries. Good stuff.
Yeah, definitely good stuff.
All right, so let's go to we are gonna do hands for the next couple because we are running way lower on time than I expected. If we could do, we'll have time for I think a couple more. Can we do hands for next, please? And Fide, could you grab someone?
Okay.
If you can tell, I don't know how to tell.
I don't see any hands raised, but I can just pick on somebody.
Yeah, no, we can move on then.
Oh.
So, okay, the role of culture and behavioral health. We're going to briefly discuss the role of culture and behavioral health, and this a couple of perspectives that I'd like to contrast before we move on. So first, there's two different approaches to clinical science and to behavioral health. One, the health determinants approach, viewing health as a state of complete physical, mental, and social well-being, not simply the absence of disease. It prioritizes the quantifiable and the directly biological. Health is binary. I like to think this is sort of the medical education that the older folks that taught me saw medicine this way. Things have changed a lot since then, but in many ways, it's a cultural foundation that remains clearly embedded in clinical care, including behavioral health. The social determinants approach is a more nuanced way of looking at things that has creeped into medical education and into behavioral health over the last several decades. Noticing that biology is important, but there are non-medical aspects of health in individuals that warrant a systemic approach as well. It does not define health as binary. The social determinants approach is what allows us to include culture as an SDOH, to quantify it as best we can, and to make it a part of our perspective. So this really gets to why does culture even matter? Culture is incredibly complicated, and it's one of those things if you can not do something that's really complicated, sometimes that's great. But this is an integral aspect of pretty much everything we do in clinical care. So these are two very different perspectives, but they're just that, perspectives. In this field, it's important to understand that there are multiple different ways that different cultures define health, and this there does not appear to be a correct answer to this question. Next one.
Okay, so how does culture complicate behavioral health?
I got a timer for, let's call it 3 minutes, Fide. You think that's enough?
I hope so.
Yeah, let's do 3 minutes, and I just want you guys to take a second and please answer this question on a digital interface or a piece of paper, please. Thank you. And Fide, in 3 minutes, you can go ahead and pick someone.
Okay. Okay, so 3 minutes is up. I'm going to go ahead and pick on somebody who hasn't spoken yet. Would Mercedes Cardona be available? Okay, I guess not. So next, we have Yumiko Molden.
Hi, good morning.
Good morning.
1 second, I'm trying to share my video. The way I look at how my culture complicates behavioral health is because growing up, behavioral health was looked at as like taboo. It was more or less, you need to pray and ask God to fix the situation, and saying that you wanted to get some therapy or something like that was frowned upon, and like to say that you're not believing in God and you're not trusting God to take care of the situation. And that kind of complicates people in my culture actually reaching out to go and get therapy and behavioral health services because they're afraid of what other people in the culture may think about you reaching out for that type of help. And so in that way, because of that thinking, it complicates behavioral health in my eyes, for my culture.
So that's an interesting narrative, Yumiko. So you're describing it essentially as a pretty significant barrier for that prevents an individual from maybe wanting to get it. So I have a couple of quick follow-ups for you. One, if you don't mind sharing, what is your cultural background as you defined it? And so your cultural background, and I guess this is a bit of a complex question, but you mentioned that it acts as sort of a barrier to access, that sometimes people may not want to go to a therapist because they're worried about the community perception. But in your opinion, do you think people believe in therapy as a process, or is that an issue as well?
I think they think of it as they're afraid to be labeled as crazy or not normal, or not being a true believer in some respect.
And what is your cultural background, if you don't mind sharing?
My cultural background, I identify as being an American descendant of slaves. I consider myself to be American and that I'm a descendant from slaves. While I know most people will say African American, I don't identify that way because I've never really lived there, but I'm an American who is a descendant of slaves that came from Africa. I don't know if that makes sense, but that's how I identify. It may not be the popular terminology, but that's who I see myself as.
I actually super appreciate you sharing that. So like an important thing about culture is it's important for you to define it as it matters to you. It's a very personal thing. And I appreciate the bravery you've had in defining it in a way that's meaningful for you. And I hope you're sharing that with people in your own clinical and practice and personal life. But thank you for that.
You're welcome. I try to when I can. I mean, it's not the popular terminology, and I kind of was leery about coming on camera and saying it, but you asked me in this form anyway, so I said it, but that is how I identify.
So there is very strong data that indicates that having a good understanding of your own cultural background in a way that's meaningful for you is incredibly important for your cognitive health. Plain and simple. It's like a performance enhancing drug in a way. So it's a good thing, and I applaud you in being so mindful of your own. Fide, could you pick someone else next?
Sure. Giselle Mejia, would you be available to provide your feedback? Hi, Giselle.
Hello, how are you?
Good.
How does culture complicate behavioral health? So I identify as I'm Mexican American, and actually it's a little bit close to how Kevin was describing how he grew up. My parents are originally from Mexico, so growing up also as the oldest sibling, there was a lot of times where I also did have to translate and assist in different things that my family was needing, my community, my church. And so I noticed that in my culture, it's also similar to what was just shared, because if you just go on and just say, oh, well, I'm going to go talk to, you know, a counselor or a therapist or something like that, people were like, well, you must be crazy, you know, something's not right. So I also observe those things. And so I feel like now that I currently work as a behavioral health case manager in a community health center, and I still see that. I still see patients coming in, and you know, they'll tell me like, oh, my husband says I'm crazy, or my children tell me I'm crazy. And I'm like, well, there's so much more to that, to being labeled as that incorrectly. There's trauma that people have been through. There's so many things that they don't know, that, you know, it's not just what they're being labeled as. So I think that's complicated, you know, people accessing behavioral health resources, from what I've seen and in my experience.
I appreciate you sharing that. It's something I've noticed as I get older and have more friends that have backgrounds from various Central or South American countries. Is there's a lot of connections between how Italians tend to see things and how you guys see things with regards to behavioral health. And I have a follow-up question that I'm interested to hear you answer. Have you found that in your family or in members of your community, if they've been in the United States for a while, that this perspective has changed, that they've been more open to the idea of behavioral health as they've spent more time here?
Yes, I think it does change, especially like I said, you know, when I speak with patients too, they say, well, I never knew that, you know, what I was going through was because of the trauma, was because of the experiences that I've been through. I didn't know there was help. It's a lot of times is because they don't know that there's resources that can help them, that can assist them. So yeah, it definitely changes once they come here and they see what's available to them.
One more question for you. If one of us was seeing a patient from a background that saw behavioral health in this way, what would be a recommendation you would make, if you have one?
I think it all starts with developing a relationship initially, just a relationship, because a lot of these patients, you know, they don't trust anybody. It's something they don't want people to know. And I think it just starts with a relationship and relating to them and sharing myself. Sometimes, you know, I understand where you're coming from, and I can support you through this. We can find somebody that also relates to you if they're looking for a specific counselor or things like that. Just letting them know that it's about them and it's about the patient.
I think that's a really interesting point and an important one. Relationship building can act as a bridge, even when there's intense cultural differences. Human beings aren't that much different from each other. We tend to focus on the differences. The more you know about your patient, the more they feel like they're understood by you, the more likely you are to see things that you can relate to each other in and see each other's mutual humanity in very intimate ways. And that helps with encouraging us to share sensitive things. So I appreciate that perspective and the vignette as well. Thank you.
Thank you.
Thank you, Giselle. Thank you, Yumiko.
I think we go on to the next one, Pete, please. Thank you. So here's an important one. How can providers be more effectively address the cultural and social aspects of behavioral health? If you were to write down a recommendation about pragmatically using this in your practice, what is it? We've all seen the screening tools and been trainings and how to integrate this, but what actually works in your practice? Let's take 3 minutes.
I guess I will start with this question. My name is Melissa. My background is Asian American. I'm of the first generation. More specific, I'm a Chinese. So I think as a patient, like a service provider, service receivers, I think for our culture, we tend to hide our own feelings, hide our true feelings about others. Our culture always told us to behave, to just, like be moderate, to be humble, and hide your actual feelings, don't be extremist. So sometimes I think it's not really good to your mental health even. And that's what I'm trying to teach. For instance, like men are not supposed to cry. You have to deal with your own problems. You are the supporter of the whole family. And the women, you have to be submissive and just listen to your husband, to your brothers and sisters. Your voice is not like as strong as the male. I think that is not very healthy. And when I was back in my own country, it was like treated like that way, and women are kind of shy to even talk about their for instance, sometimes they were abused at home and they take it for just they think that's a normal thing, and they think that something's wrong with themselves. They afraid or they ashamed to even open up, telling other people or even the health providers. Like for instance, in this country, I know the doctors always ask you the first question: do you feel safe at home? However, I guess if they don't understand the culture, for some Asian women, they think that question is maybe even offensive because they are not supposed to even talk about their own situations. It's kind of covered up, and within everything handled within the family, like, is just not good. I think if you understand the culture, and sometimes even for I work for HUD, and I have my own customers, clients. When I talk to them, I sometimes, based on the daily regular conversation, you can kind of you can tell something is not right. However, the other party is afraid or feel ashamed. They're not open to discuss their issues. So I think that will make the service providers be more sensitive to the situation of the other parties, so they can be like they can understand, sense if there's any signals, alerts, so they kind of like engage another conversation or even help. That's my thought.
So, I mean, I appreciate the narrative and the openness about this. And a couple of things came to mind to me that I think is important for the group as you were sharing. So what was interesting to me is this is very different than my own cultural background, where people tend to share their feelings a little too much. And therapy can be an easier sell because there's talking about feelings isn't necessarily as taboo. But you're describing a situation where talking about feelings can be a very serious taboo to people, that to the point where it's a pretty significant barrier to care. Another thing came into mind when you were talking about being able to see if people, when something isn't right. It seems like that's something that would take a level of familiarity with the culture in order to be able to do, which is also a barrier because those who aren't from your culture may not be able to do that. So my question for you is, when you think of these barriers that you described, what is there a recommendation you would have for a provider seeing a patient like that in traversing those?
I mean, I guess it's kind of complicated because you have to keep that in mind. I mean, just for example, my son was born here, and he was like, actually, he's 100% American.
Mm-hmm. Melissa, I think we lost you.
Yeah, I think it got cut off.
Oh no, poor dear.
I wanted to add to it.
Oh, please do.
Yes,
Sorry.
about how can providers more effectively address the culture. So we'll definitely address it. It will be my key. Address it. Like, don't act like it doesn't exist. Don't act like we are counseling in a vacuum and we're all devoid of feelings and opinions. So at least acknowledge for your clients, you know, if you have a Black client and you're not Black, right? Or, you know, you see the George Floyd stuff is going on, you know, we're not going to act like that's not happening, is my point. You know, when you're and you see that for a Black male right now in society, they're getting a really good short end of the stick, right? If you are male and you're dealing with a woman, you know, our rights are literally being trampled on across the world. So it's not to act like you don't see that happening. If I'm dealing with an issue, right, to know that that's also weighing on me. The acute issue may be I'm arguing with my husband, or, you know, I'm dealing with stress and depression, you know, the big issue. But along with all of that is, in my mind, my rights are being trampled on, and depending upon which state you're in, it may already be gone. I'm in Pennsylvania, so this vote right now coming up in November matters to affect that right now for our state. So anyway, that's just what I was going to say, to address it, to not act like it's not happening, to not ignore it, to not even bring it into the counseling discussion. That how is that affecting you? I saw on the news, you know, based on whatever gender or culture they're from, and if you see something on the news that you know probably is traumatically affecting their culture group, you know, you can just put it out there. Is there anything you want to discuss, you know, going on with you? I've been watching the news. It's a lot going on. You don't even have to be specific. There's a lot going on in the news. Is there anything that you see impacting you, or what we're here to talk about today, you know, related to the news and current events? That's all.
I really appreciate that perspective, Aisha. And I appreciate you sharing it. Those aren't easy things to talk about. But here's the thing, they're really important things to hear. And there were a couple of things that stood out to me. One, I think it's important to realize that certain patients that we have always feel like they're under assault from society. And that's a unique stressor that not everyone needs to feel. And if you felt that stressor at a certain part of your life and something changed and you notice that things are easier, not having some of those stressors can make the difference. But some of our patients are forced to walk with them every day, no matter what. So that's an important thing to remember. Also, the importance of knowing your community. You spoke specifically of things that Black men or Black women are thinking about as they walk through the world. Well, if those are my patients, I want to know and understand that. And you can't know and understand that if you don't ask. So I thought that was very powerful and interesting. And I'm certainly going to integrate that into my practice. My question for you is, you appear to be, and sorry if this is an assumption, describing a community that you may be a member of. If someone wasn't a member of your community, how could that stuff be addressed? How could that be addressed effectively in a way that would be good for the patient?
Well, I would definitely use some of the strategies I suggested, as far as just asking that question for sure. Are you being impacted? Is this affecting your household?
Mm-hmm.
How do you interpret that in your direct, you know, in your direct, your home, your neighborhood? How do you see it being a negative or a positive in your life? So then that would help me understand how maybe I can address it, or if I need to even do some more research, right? I might need to do some more research on their culture. If I'm totally clueless to the things going on, I need to do that. As a good counselor, good to be effective, you would do some background research if they start to bring things up and you're like, oh, and you can always ask, right, your client to explain stuff to you. Right? They can always tell you, so, okay, so you're Muslim. So what does that mean when you go to Ramadan? What does that mean for you if you were limited and your job said you couldn't go to prayer? You know, because that could be an issue that we're discussing. I'm Christian and I worked for a Muslim, he owned the company for drug and alcohol. And so we agreed to talk about God. Like if we were addressing each other and we wanted to say something spiritual, faith-based related, we would say, okay, God bless you. Because that we had in common. You know, I wouldn't shove Jesus down his throat per se, right? Because Jesus is an issue for Muslims. But he didn't disrespect me. I had crosses all up and through my office, right? And I've worked with atheists, I've worked with agnostics, I've worked with people who might have been being a little racist, you know. But by the time we finished, they respected my belief because they knew. Because if they asked me, I said, "Do not ask me about my belief if you don't want the answer." So you know, we always had that. And so if they asked me, you know, if they invited in, then I would answer. And then they would ask, and I would ask them. So how does that impact you? Does that make you feel any type of way? Would you need a different therapist? Because these are my beliefs. And usually, I have to tell you, so far in my experience, I was always open with my belief, and that never negatively impacted my therapeutic relationships with folks. And ironically, I have to say humorously, even by agnostics and atheists, by the end of sessions, they'd be like, "Miss Mobley, can you pray for me?" And my heart was overjoyed when they would actually ask me for a prayer, like, because they knew I was a praying person. So maybe they don't pray, but they would say, "Miss Mobley, I know you pray. So could you pray for me, you know, when you're praying?" It wasn't like I shoved it down their throats, but I did not hide what my belief was. So I want to be transparent about that as well. I did not put a cross up in my office because I am a believer. And so I would always put that out there. So I mean, I don't guess that works at every agency. You know, you may not be able to do that at every agency, but because this was, you know, private owned, and the name of the agency was Muslim. So we were able to be open about that. But I know every place isn't like that. That's how I handled it.
That is a unique circumstance, of course, but it points to a really important point with understanding of culture, cultural competency, and culture as a SDOH is take opportunities to connect with people. What you saw is a similarity that could foster a connection between yourself, your employer, and your patients, and you took that. It's very difficult to find somewhere where you can't find something like that with them, to connect with them. You will find something in common with every one of your patients. Find that and use it to create a bridge. Thank you for that. Fide, can we move to the next one, please?
Thank you, Aisha.
All right, so here are our answers. We'll go to the next one. And we've done this as well. Next one, please. Defining culture and context. Okay. So let's just quickly, the definition of what HHS, Office of Minority Health, says about culture. And they describe it as integrated patterns of human behavior that include language, thoughts, communications, actions, customs, beliefs, values, and institutions of racial, ethnic, religious, or social groups. Now, that is the definition of a mouthful, for sure, but this is a complex subject. And I do want to note that there are many different definitions of what culture is and how it pertains to this field. In general, academic definitions tend to be a little more complicated than this. And they often include social and economic class as key aspects of culture. Those are especially not popular topics to talk about, but as someone who has a grounding in the literature, I would strongly recommend that you include and consider economic and social class as important aspects that define culture in humans, and in your patients. Next one, please.
Okay, so for this question we have, how do you define your own cultural identity in terms of the following categories? Feel free to omit any category that you feel is not relevant to your cultural identity. So
Fide, just a quick interruption. We're nearing the end. We're going to do 2 on this and then move on. We might be going to like 2:03 or something, or a little more. If someone needs to jump off, feel free. Sorry, Fide, go ahead.
Okay. All right. So this is actually one of the questions. If you can provide your response. And then in my personal perspective, I believe I would define my cultural identity as I am Latina. I was born in Honduras and I came here when I was 12 years old. So a lot of the customs and beliefs that Honduras generally have, I still have even now, even though I've been living here in the US for many years. So that is part of what my cultural identity is. So we would like to hear from you, and we're going to give you about 2 minutes, right, Kevin?
Mm-hmm.
I think
Actually, people take let's take a minute and think about this, because this tends to be a quick one. So let's take a minute and think about it. And I will say, like, and that's including now as I'm blabbing, feel free to tune out as you're writing. Include the interesting or weird stuff in there too. Like I define my cultural background as Italian American, but my father's Sicilian and my mother's from the south of Italy, and they speak different languages. So I grew up hearing Sicilian in my father's family and Neapolitan dialect in my mother's family. And when they spoke together, they would use proper Italian. And that was a very confusing linguistic environment for me to grow up. So as a result, I define my ethnicity not just as Italian American, but the language groups and regional identities that my parents have. So there's some interesting detail in everyone's cultural background that could give all of us insight into each other. So if you got something interesting you'd like to share, please add it in there. And Fide, you can go ahead and pick. We'll go with 2 from raised hands, please.
Okay. Kiona Woods, I'm gonna unmute your line.
And if we could keep responses to a minute, please, folks.
Okay, so like earlier I mentioned that as African American, one of the things I like to identify as too is because both of my parents are ex-military, so I moved around a lot when I was younger and stuff. And that's something I always remember, because people always give you the question, where are you from? And then I'm like, well, I lived here, I was born there. And then, no, where did you? I was like, well, I'm not really from anywhere, because we moved around like 5 years at a time someplace. So I didn't stay somewhere for a long time, because like I was born in California, but we lived in Hawaii, Texas, and Florida and stuff like that. So I've been around, and then also because of that, I also have a pretty good cultural background, because when you're in the military, you're around all sorts of cultures and you're privy to a lot of things. And then beliefs, I have a Christian background, family like that. And then also the values you get from being more in tune with learning about different things and learning different areas. Like when we lived in Hawaii, we like bento boxes and stuff. We were introduced to Japanese culture and different stuff like that there. So that's how I identify myself. Not really, class is not something I really use. Not really.
Well, I think that's an interesting perspective, and what I appreciated about it is, when someone say define your culture to Americans, we typically tend to think pretty quickly about things like the country your family came from or your racial and ethnic background. It makes sense in a country with history like ours that people would do that, but there are other parts of our lives that can be just as, if not more important to shaping who we become as adults, including how much we move around and what we're exposed to. So that's in a way, your cultural background is shaped by your individual experiences, and that's a very important part of it. So thank you for that. Fide, you got time for one more.
Okay. I don't see anybody raising their hand right now, but we can pick Jose Flores or Chris Maddox. Would you like to?
I can go really quickly. So I'm African American. I'm a Black man. I consider myself, part of my identity really is coming from an interracial, intercultural family. My stepfather, he raised me, he's a Polish immigrant, and my mother's Black. And so I also come from a blended family as well. I have a large extended family that also is interracial, intercultural. So that's like a big part of my family, is just mixing together. And so that's also in my own relationship. So that's a very big part of me. Diversity is huge to me. Part of the reason why I'm in psychology as well. By the way, I'm a doctorate student. I go to Chatham University, getting my doctorate in counseling psychology.
I think I love this about you, Jose. I'm not from a mixed background myself. I know a lot of people that are, and it seems like it's a unique challenge to understand and reflect on one's identity, and that you really need to invest a lot of time into that. my daughter's mixed race, and I've seen how, as she gets older, she deals with these concepts, and they're more difficult for her than they were for me, that's for sure. So I think it's great that you're that advanced in your understanding of that and applying that to your academic career in such a real way. Ooh, there goes my timer. So thank you for that, and thank you for sharing. Please send emails with feedback. If something's not working for you, please let me know. This is an experimental format. And we'll see you next time to start really getting into the details, what this topic means and how we can practically apply it to our practice. So thank you all for sharing and for certainly helping me better understand these things. If anyone has questions or wants to chat about something, I will stay for a little bit.